Benvenuti a tutti. Sono sicuro che questo incontro con Richard Horton, direttore della rivista The Lancet, che è una delle più importanti riviste scientifiche e mediche in particolare del mondo, e col professor Giuseppe Remuzzi, direttore dell'Istituto Mario Negri Bergamo, sarà molto molto interessante. Il titolo che abbiamo voluto dare è Pandemia o Sindemia. Non è un titolo che abbiamo dato a caso perché è un mantra, diciamo così, di Richard Horton, a cui ora mi rivolgerò e che ringrazio di essere con noi oggi. Thank you, Mr. Horton, for joining us today. Thank you for your time. And first question. Mr. Horton, you wrote that COVID-19 is not a pandemia, but a syndemia. What do you mean exactly with this? Is just a matter of comorbidity, just a clinical impact on other chronic diseases, or is something else? Is a social impact of the COVID-19? Please, Mr. Horton.
Well, thank you for identifying the distinction between pandemic and syndemic. It might seem a little pedantic and playing with words, but it's actually a very profound difference. Back in the 1990s, an American anthropologist called Merrill Singer was studying the AIDS epidemic, and he saw how AIDS interacted with other diseases, such as tuberculosis, often in situations of striking inequality and poverty. And so he devised the idea of a syndemic, in other words, a synthesis of epidemics. So in the case of AIDS, AIDS was one epidemic. It was interacting with a second epidemic, tuberculosis, and it was not a comorbidity. AIDS made tuberculosis worse, and if you had tuberculosis, that made your AIDS worse. And if you were in a situation of poverty or inequality, then both diseases were worsened still further. So fast forward to COVID-19. My argument is that COVID-19 is a syndemic because you have a virus that is interacting with a range of chronic diseases. And if a person, especially somebody who is older, has a history of heart disease, respiratory disease, diabetes, obesity, then the disease that COVID-19 is much worse among those patients. So COVID-19 worsens their chronic disease, and their chronic disease worsens COVID-19. And we also know that COVID-19 is worse in populations who are more marginalized, more vulnerable, living in poverty, suffering the effects of inequality. So this is a very important distinction, because if we're going to fight the pandemic, we have to treat it as a syndemic. If we focus only on the virus, we will fail. We have to also improve the overall health of the population and address inequality. So that is why the distinction between pandemic and syndemic is so important. It totally changes our perspective on this virus.
Thank you, Mr. Horton. Very clear. It's a social problem, a political problem. And now I want to listen Beppe Remuzzi, poi lui parla in italiano. Beppe, pensi che le considerazioni che ha fatto Richard Horton siano valide a livello internazionale, ovviamente, e valgono però anche per il nostro paese? Cioè anche qui ci sono diseguaglianze che sono state esacerbate dalla pandemia?
Assolutamente, è meglio che parlo in inglese così sente anche Richard, giusto?
Come vuoi.
So it's absolutely yes. Is regarding all the world, is regarding since South America to Africa to Asia to Europe, everywhere is absolutely the same thing. Everywhere we have no comorbidities, but we have one disease that is worsening another disease and vice versa. And if I can add something to what Richard just said, in order to reinforce the concept, there is a person, you know that people are talking in television every day nowadays. I don't know whether it is like that in England, but so-called scientists are talking in television and talking and talking. And I was curious because one day one of them said, why should a nephrologist talk about COVID-19? And the reason is that if you have COVID-19 and if you have renal failure, or if you have a renal disease, your chance of dying is 5 times higher. So this is exactly the concept of syndemia. Kidney diseases worsen COVID-19, and 19 causes kidney disease, and both synergize in giving more people dying. And could you imagine that in the world, you have every year 5 to 7 million people dying simply because dialysis is not available? Could you imagine the association between kidney disease and the COVID-19, not simply as comorbidity, but as a disease that influence each other?
Do you think this kind of impact we can suffer also in our country?
Yes, absolutely. This is exactly what happens in our countries. You know, there is a long discussion about why we have so many people dying. In fact, the answer to me is that these people actually are people who are linked to life in a very subtle and fragile way. Those are people with renal failure, cardiac disease, diabetes, hypertension, and so on, everything we know, or they are poor. And being affected by COVID-19 results in a very high number of people who die. So this applies to our country exactly as to other countries in the world.
Thank you. Dr. Horton, and the second question for you is, looking at what has happened, how do you consider what has been done? And if there were mistakes, which have been the main ones? And in particular, what do you think about the way WHO managed the situation? What didn't work eventually?
Well, thank you very much. Just to add to what Beppe mentioned in his previous answer, I think that there has been a huge underestimation of the link between COVID-19 and renal disease. We had a big focus on the number of ventilators that were available for patients with COVID-19 in the early part of the pandemic, but we almost ran out of dialysis facilities as well. So I just want to underline what Beppe was saying. Now, as to the failures or the mistakes, I mean, this is a subject for a public inquiry in your country, in my country. But I think we know enough to have some preliminary responses. Let me deal first of all with the global failure. I've been very public about supporting the World Health Organization's response in January. I do believe that they responded rapidly and decisively in early January when they first learned of the threat of a new virus in Wuhan. They established an incident monitoring team in the very first days of January, convened the International Health Regulations of Emergency Committee that met twice, and by the end of the month, had declared a public health emergency of international concern. WHO has never moved faster in declaring a public health emergency in this way, and they deserve to be commended. But the problem was, what did they do after they declared a public health emergency? They were very effective at holding press conferences and communicating, but what they didn't do was to convene their member states immediately in order to work out a global plan. And the result was that 194 member states pursued 194 separate strategies to address COVID-19. And so there was global chaos instead of global coordination. And this was a catastrophic failure. It's still amazing to me that in the intervening 10 or 11 months, there still has not been any attempt to coordinate a global response. Now, at the national level, I think there are several reasons for failure. First of all, the evidence coming out of China was quickly and clearly communicated. We at the Lancet published 5 papers in the final week of January that described the clinical presentation, the fact of person-to-person transmission, the fact of the link to that this was a coronavirus, and indeed the risk of a global pandemic. But Western governments and North American governments did not pay attention to this very clear signal. Now, the question then, which is speculative, is why? Was the evidence from China not believed? Was there a view that somehow China didn't have the capacity to manage an outbreak of a new infectious disease, but the West could, and therefore we could be relaxed about it? It's very hard to be precise. What is very clear is that our response was too slow, too indecisive. We were not prepared for this pandemic when it hit Europe, first in Germany, but much more seriously in the Lombardy region of your country. We had poor public communication about the threat of the virus. We indeed were preparing for influenza rather than a SARS-like virus. So the answer to your very simple question is that there is a multiplicity of reasons, a sequence of failures, which really exposed what I would describe as the greatest science policy failure for a generation. It's an extraordinary moment in Western Western history, and exposes our vulnerabilities like no threat has ever exposed them before. Thank you.
Thank you, Mr. Horton. Beppe, what do you think about the same question for you?
Well, I think that we as a public health response, as countries, at least in Europe, I believe it was the same in the United States, we are simply not prepared to consider public health and prevention something that could be incorporated in the strategy of the future of medical care. More and more, medical care has to do with what at least 40 years ago, Bud Rellman, who was a brilliant editor of the New England Journal of Medicine and of the Journal of Clinical Investigation before that, and was a great doctor, has defined the industry of the health. And the industry of the health is not too much concerned about health of people, about prevention, about being prepared to public disaster that may happen in modern time. But we are much concerned about how much money you can gain from someone who is sick. And the consequence was that when something arrived, we were simply not prepared. We were absolutely indifferent to the important paper that we published in the Lancet 14th of January, showing exactly the symptoms of the disease, showing that the disease could spread from people to people, showing that social distancing could be even more important than masks, and showing a number of features that we simply did not care about. When I say we, I say all of us, including me, including someone like the most important advisors of the most important government in the world. People were used to think this is something that may happen in China or South Korea, but will never reach us. And this was a misjudgment that together with the fact that we had no attention for our public health system was to me something that together has created the condition for what indeed happened.
Thank you, Beppe. Dr. Horton, the third question is strongly linked with the previous one. That is, one thing is clear anyway. As a global society, we have not learned the lesson that the first SARS epidemic gave us in 2002-2003. Yet there were many signs that should have warned us, suggesting that something like this could have happened again. I mean, MERS, Ebola, Zika. What was missing?
Well, it's a great question, actually, Luigi. If you go back to 2002, and I've gone back to that time, I, like you, lived through it, and I've gone back to read the reports and analyzing the global response to SARS back then. What's very striking is that we completely misdiagnosed what happened in 2002 and 2003. So at the end of 2002, a brand new virus appears. China tries to deceive the world and deny that it exists. Then the Chinese government gets called out by the Director General of WHO, Gro Harlem Brundtland. China then backs down, does disclose that they have a new outbreak of a new virus. That virus has meanwhile spread to half a dozen countries around the world in the East Asian region, like Vietnam, but also as far as Canada. But thanks to a little bit of action by those countries, the outbreak shuts down in the first 6 months of 2003. Now, this event, how was it interpreted? You go back and read every report on SARS, and they make it very clear that this was a triumph of public health success. This was a grand victory of modern global health. But with the benefit of hindsight, it was clearly no such thing. The truth is that we were lucky. And we were lucky that that SARS virus was not more transmissible. It was more deadly than SARS-CoV-2, but it was not more transmissible. It was less transmissible. And we were lucky that it was less transmissible, because with relatively basic public health interventions, nothing like what we're doing now, the outbreak could be quickly suppressed. So luck, not skill, was the lesson from SARS in 2002, 2003. And because we interpreted that result through the lens of exceptional skill and ability, we developed a feeling of Western exceptionalism. We, I think, felt invulnerable to threats, that we could easily deal with any virus coming from Asia or any other part of the world, that we were well prepared. If we go back in my country and look at the early press conferences that were held in March and April, we had government scientific advisors, not politicians, but scientific advisors, saying that we were well prepared. Indeed, we were, in their words, an exemplar. We were the best prepared of nations for any pandemic. And quite clearly, that was not the case. So we were living in this bubble of believing that we were somehow protected, whereas in fact, we were extremely vulnerable. So I think that is how I would read history. We misread history, and it's very important we don't misread history this time around. Thank you.
Thank you. Beppe, the same question for you, of course, focusing on Italy. What was missing here in particular?
Yes, Luigi, I think that we are facing a similar situation in Italy. We were convinced that we had one of the strongest national health system, certainly of Europe and probably of the world. And this is because in theory, we had a national health system which is offering care to treatment to anyone, to migrants, to people who are here in our territory. And our constitution is such that everyone that is living here in Italy has the right of having access to treatment for their diseases without paying anything. But in fact, this was not true, and the virus documented very well that we were not prepared, and that we were not prepared especially to treat this disease at the beginning of their manifestation and in the so-called primary care. Primary care, if we want to be honest, is honestly almost non-existing in Italy. Is not organized, is left to people who are in fact free of doing essentially what they want. They have a convention with the national health system, but they do not belong to the health system of the region where they live. So we have excellent hospitals, but everyone in primary care is free to do what they want. The result was that 10 to 20% of primary care doctors did wonderful things. And in fact, most of their patients did not need hospital care, but everyone else went to the emergency room. It is absolutely a fact that anyone can confirm that people were calling their doctors at home saying, I have fever, I have anosmia, I have joint pain, I have cough. And doctor said, well, stay home and take some medication to lower the fever. Typically, what is now as a common name of tachipirina. Take tachipirina, stay home, don't come to my office because you can infect other patients. Don't go to the hospital because you can be infected. So the primary care was the failure of our national health system. So we had not a strong national system as we were convinced to have. Hospital did a wonderful job simply because all people went to the emergency room, including those who had no need of emergency room. And what happened was that in some cases, the emergency room and the hospital were so crowded, particularly in February and March, that some people was forced to stay home without assistance. And in this part of the world where I live, many people died at home without any assistance. So the idea that we have the best national health system in the Western world is in fact not true, and the virus was capable of disclosing that failure very clearly.
Okay, thank you, Beppe. This is a big issue, very complex issue. I think we should discuss it for hours. But that I have to do the next question to Mr. Horton, again about the social and political impact of COVID-19. What happened underlined the importance of a global response, reminded us that we are interconnected and that no one wins alone. But on the other hand, we are experiencing strong nationalistic and even xenophobic bounces. Which of these two movements do you think will prevail, and which consequence we will have at the end of the day?
Yes, yeah, Luigi, that's the $100 billion question of our political times, isn't it? It's and I think the honest answer to that question is that it's the outcome is going to be different for different countries. We've just lived through 4 years of President Donald Trump, and he was, without question, presiding over the most populist American government probably ever, or certainly in the last century. And now we have President-elect Biden, who's clearly not a populist, who's going to be very much center ground in politics, who will bring back a degree of managerial competence, administrative competence to the American government. So the era of extreme populism in America seems to be at least temporarily over. Whereas look at my poor country. We're going through the trauma of Brexit with a very populist government, which is responsible for that trauma. And we have another 4 years of that government. They've made a total chaotic mess of the response to COVID-19. And the past 12 months has been a disaster. So we're living with populism, and we'll continue to do so. And America's through it. In Italy, I'm an outsider, so I should be careful what I say. But you have been through an era of populist government, and at least to the outsider, it seems that you're passing through a less populist phase, a more administratively middle-of-the-road phase. So the outcome is uncertain for each country. And so we will have to wait and see. What I'm concerned about, though, in relation to your question, is this. So many Western nations have manifestly failed in their response to COVID-19. And the origin of populism comes from the belief that governments, established elites, have failed to serve the needs of the people. And because that thesis has been proven, that established elites have failed to serve the needs of the people, my deep concern is that that could fuel a new wave of populism. So we should be extremely vigilant for that potential outcome. One consequence of COVID-19, though, that I think is an opportunity is this. For the past 40 years, since the era of Ronald Reagan and Margaret Thatcher, we've been living through a period that some call neoliberalism. In other words, a period of intensified market-based capitalism, a belief that the market can solve our social problems just as it can address the allocation of scarce resources. That has led to a drive for efficiency, a small government, a small state, reduced public investment. COVID-19 is going to lead to the rebirth of the state, greater investment in public services, whether those public services be health, welfare, social protection, education. The importance of government has never been clearer. So I think that we're passing through a phase now, which is a crisis in modern neoliberal capitalism, with the potential opportunity for the rebirth of government and the credibility of the state being enhanced. So I see threats with the potential fueling of populism, but also this opportunity to strengthen government and to bring a greater respect for the role of the state in our lives. The outcome of those two forces, Luigi, remains to be seen.
Dr. Horton, this drives me to the next question. That is, can you think that science could be a vaccine for such problem? I mean, do you think that scientists could be more involved in politics directly? I mean,
well, that's also it's a very interesting point you make, because in my lifetime of working at the Lancet, this is my 30th year at the Lancet, I've never seen a response from the scientific community that's been so extraordinary. I mean, we published the first paper from Wuhan on January the 24th, and we published the first randomized trial results of a phase 3 randomized trial results of a vaccine from Oxford AstraZeneca on December the 8th. That's 321 days. It felt like a long year, but in scientific terms, it was an extremely short year. So science serves society in a completely unprecedented way. That was remarkable. But I do worry now about the relationship between science and government. We live in a democracy. We do not live in a technocracy. And as much as I'm delighted that scientists are advising government, scientists are not elected by the public, politicians are. And scientists are just as prone to the biases and corruptibility as any other group in society is. The difference is that scientists are not held accountable by the electorate in the same way that elected politicians are. So I want to see more scientists going into public life, having a voice in the public sphere. But I also want to make sure that they do that with the democratic values that we so enjoy in our European nations. I do not want to see the growth of a technocracy, a form of government that is driven or limited by unelected experts. So there's an opportunity there for more scientists to play a role in our culture, but it should be with the democratic values that we have fostered over centuries, rather than in any other way.
Beppe, what do you think about? Do you agree with Mr. Horton? Have you the same opinion?
I couldn't agree more. I think that more and more scientists have to be involved in political arena, because after all, let me give you an example. It is clear now that we need a reform of our national health system, that we were used to think it was the best of the world. And in order to do that, we have to be involved with political decision. Political decisions are extremely important for the health of our fellow citizens. But I think that we can tell politicians what the scientific literature says, which is the debate in science, which is known and which is not, what we know for sure and what we don't know for sure. What about, one of the simple things, everyone is talking about asymptomatic people. Are they contagious as symptomatic or pre-symptomatic are? We simply don't know exactly, but we have some clear idea that have been generated from many studies done so far. We have to tell people exactly what we know, and we have to be part of the political arena. But we have to realize that the political decision is to the politicians that may have a decision to make, first of all, because they have to be accountable, as Richard said, but also because what they have to decide is much more complex than it seems to us. For instance, if you want to eliminate the virus, just shut down a particular country for 12 months and the virus will disappear. You close the frontiers, you do not allow people to move, and this is done. And this is from the point of view of virus. But politicians have to take into account a huge number of our things, including what happens when people cannot move, when people cannot go to work, when people have families and children to raise without the possibility of an income. So we have to take part in the political arena. I am very against those scientists that said, I am a scientist, I don't care about politics. We have to be involved in political arena, but our mission is completely different.
Okay, thank you, Beppe. Mr. Horton, of course, I have to ask you, what do you think about the coming vaccines and medical therapies?
Well, as I just mentioned, it's an extraordinary story, isn't it? 321 days. It normally takes 7 to 10 years to be able to develop a vaccine. And although I don't want to make a political point particularly, I thought there was something rather inspiring about two individuals with Turkish heritage working in Germany, devising a vaccine for the world. It shows the importance of that interdependence, the idea of a global solidarity, that no country, no culture is going to succeed on its own, that we all need to work together. If you have a global emergency, you need a global solution, and that means cooperation in an unprecedented way. And I think we've seen that by the scientific community. No, I mean it's remarkable. We have 13 vaccines in phase 3 clinical trials. We have 40 or 50 in phase 1, phase 2 trials, and over 200, maybe even 300 in preclinical development. It's true, I think, that the vaccines you're seeing rolled out today will not be the vaccines that are going to be used in 2 or 3 years' time. There's still a lot we don't know about the duration of immunity, the risk of vaccine escape, our own immunological response to the vaccine, but it's nevertheless a remarkable story. But you know, one thing, Luigi, about this year, not being able to travel, it's enabled us all to do a lot more reading. And I spent the summer reading properly, for the first time actually, the history of smallpox eradication. And there's some very interesting lessons in smallpox eradication. You know, the World Health Organization made a commitment to eradicate smallpox in the 1950s and then intensified its campaign in 1967. Smallpox was eradicated in 1977, finally. So it took 10 years from the final commitment Now, smallpox is not COVID-19, it's not SARS-CoV-2. And we're not going to eradicate SARS-CoV-2. It's too endemic in our communities to eradicate it. We can just suppress it. But there are some lessons. And I think the big lesson is this. The lesson from smallpox is, yes, it's really important to have a vaccine, no question about it. But our success will not come from just the magic bullet of a vaccine. It's going to depend upon manufacturing enough vaccine. It's going to depend on infrastructure and distribution of that vaccine, the extent of coverage of the vaccine, the pace, the speed at which we can vaccinate communities, making sure that we leave no community and nobody behind. If you, for a virus like SARS-CoV-2 with an R0 of 2.5 and a vaccine with an efficacy of 90%, we're probably going to have to immunize 2/3 of the world's population to achieve herd immunity. That is a massive challenge. And it's not a scientific challenge, it's a logistical challenge, it's an implementation challenge. And it was Halfdan Mahler, a former Director General of WHO, who said that the eradication of smallpox was more to do with management than medicine. And in the 21st century, we have an even bigger threat that we didn't have with smallpox. And that, of course, is the anti-vaccination movement. And the anti-vaccination movement is alive, it's growing, it's mobilizing, and it is a clear and present danger to the vaccination programs being rolled out in countries today. And we, all of us in society, not just doctors or health workers or scientists, but all figures, people in the media, people in our culture, political leaders, we all have a responsibility to defeat the invidious arguments of the anti-vaccination movement, while at the same time listening, explaining, and answering perfectly legitimate questions from the public about the science of COVID vaccines and about the safety of those vaccines, because the public will naturally be concerned that in producing a vaccine so fast, have corners being cut. And it is our responsibility to assure the public that no corners have been cut, that we're in this enviable situation because of an extraordinary scientific collaboration. And safety is the #1 priority in the research on a COVID-19 vaccine. Thank you.
Thank you. Beppe, what do you want to say to Italian people who are afraid to be vaccinated about this?
Listen, I think that we had, as a scientist, an approach in the past which was probably wrong. And the approach we had in the past as a scientific community was to try to say that these people is ridiculous, that in fact the vaccine saves millions of lives, that in fact as compared to any other medication, possibly beside aspirin, vaccines were in fact a medication that in front of very few side effects had an unbelievable advantage for people in terms of number of lives saved and how many children have been saved in Africa because of vaccines and so on. Now I think it is time to change our approach with these people and to take them seriously, to take their questions seriously, to say to them that things may happen to people that are vaccinated. They may have side effects. But we have to tell them the truth. We have to tell what we know and what we don't know about the other vaccines, with our experience with the other vaccines. We have to tell them exactly what can happen with the vaccine for COVID-19, to the extent that you know that. We don't know many things already, but what we know we should disclose very openly. For instance, we have to talk about allergic reaction that may happen. We may say that allergic reaction can be severe, but this may happen very, very rarely and offer numbers. we have to say that allergic reaction to a vaccine are treatable if you are giving the vaccine in a proper facility. And also, we have to tell them that you can have exactly the same allergic reaction by taking some food that may be even more severe than with vaccines. So every one of us can be exposed to allergic reaction, particularly those who are predisposed by taking simple food or things that for the majority of other people create no problems. We may tell them that you may have fever, you can expect to have fever, that the fever occasionally can be also high fever, like 38, 40 centigrade, but that everything will disappear in 2 days. I think that the approach to these people has to be transparent, consistent, sophisticated, based on data, and consistent among all the segments of the society. So we need help with the television, media, doctor, nurses, everyone should talk the same language. And I think that this will be fixed one day or another.
Thank you, Beppe. The last question for Dr. Horton. Well, coming to an end, what do you want to say to Italian people who are listening to you, and if you want, to the Italian institution too? Well, give us a take-home message, please.
Thank you, Luigi, and thank you, Beppe. It's been a shocking year. We've seen, like never before, that our society is brittle. It's fragile. Progress that we have come to take for granted is not inevitable. Even in Western societies, reversal is possible. And we've seen a reversal. We're now going through the worst economic recession for 300 years. And it's going to take a generation to come out of that recession fully. And the impact on a whole generation of young people, children and young people, is really, really tough. I do believe that COVID-19 has opened a new epoch, a new era in our lives. It will change governments, it will change societies, it will change public opinion. I think that we will take health more seriously. There will be a rebirth of the state. The public will have greater demands of the state and politicians for protection. I think in the longer run, we will want to work more closely together. I think moments like Brexit will be an aberration. And actually countries will realize that only by working ever more closely together will we be able to protect one another more effectively. I think we will invest in our health systems to produce resilient health systems. I do believe that we will want to create fairer societies to protect those who are most vulnerable, whether they're old or young, people with disease, Black, Asian, minority ethnic communities. We will demand a fairer society. And we will ask the question about what we owe to each other. And I think lastly, we will find a way to remember this moment, this year of 2020, this year when our world was turned upside down, when far too many families suffered the needless loss of a loved one, so that nothing like this can ever take place again. Thank you, Luigi.
Thank you, Dr. Horton. Grazie al professor Remuzzi. Io penso e spero che tutti voi che avete voluto seguire questo incontro abbiate potuto apprezzare il privilegio di poter sentire dalla viva voce del dottor Horton le sue opinioni, e ringrazio tutti e rimando al prossimo appuntamento di Fondazione Corriere della Sera. Thank you, Dr. Horton. Grazie, Beppe.